resurgence, including widespread illness and healthcare worker absenteeism, has contributed to prolonged impacts on the health system. With the BA2 sublineage of Omicron predominating and the SARS-CoV-2 virus continuing to evolve, the path ahead may not be smooth. But with the warmer weather beginning, it is hoped that with continued caution, we can enjoy a period of lower activity and some time for recovery. That's why the theme of this year's Mental Health Week is so fitting, as it focuses on how we can learn and hone our empathy skills to help each other. Through this week's communications, information, and resources, the Canadian Mental Health Association encourages us to develop and practice these skills, starting with listening to one another without judgment. That is to say, empathy helps us put ourselves in someone else's shoes and seek to understand their point of view. This not only helps us to connect with and support others, it can also help us regulate our own emotions and reduce feelings of isolation. The pandemic has impacted our lives in many ways, with some research suggesting that up to 50% of us in Canada have experienced declines in our mental health during the pandemic. We know that these impacts have affected certain groups more than others, and that as the pandemic has evolved, we have faced different challenges, including now. While many are happy to have measures easing, this can also bring about anxiety and stress as communities adapt to the changes. At this time, as throughout the pandemic, Wellness Together Canada continues to offer confidential virtual mental health and substance use resources and supports to people of all ages in Canada. To date, almost 2.3 million people across Canada have used these supports, which are offered at no cost, 24 hours a day, 7 days a week. When it comes to mental health, every action counts. I urge all people in Canada to do what they can to support their own mental health and well-being and that of their family and friends. Practicing empathy through an act of kindness for someone can go a long way, and together we can all help to create positive change in our schools, workplaces, and communities. Although we may experience further ups and downs in the COVID-19 trajectory going forward, maintaining a vaccine plus approach can keep us prepared and better protected. This means remaining aware of COVID-19 activity in your local area and continuing to take personal precautions like staying at home if you're symptomatic or test positive, improving ventilation, and continuing to wear a mask in shared indoor or crowded spaces when with people you don't live with. Always at the core of Vaccine Plus is staying up to date with all the vaccine doses recommended for you. That means a primary series of COVID-19 vaccines for everyone 5 years of age or older, and booster doses as recommended for those aged 12 years or older. As we resume more activities and connections in Canada and globally, other serious infectious diseases such as influenza and measles are making a comeback. Canada is reporting increased influenza activity in recent weeks, and the World Health Organization have reported a 79% increase in worldwide measles cases in the first 2 months of this year compared to the same time last year. As these are vaccine-preventable diseases, delayed or missed vaccinations during the pandemic in particular is a key factor in these rising disease trends. No matter what our age, we need to keep vaccinations up to date throughout our lives. Make prevention part of your health plan by checking in with your health provider or local healthcare resources. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Good day, everyone.
Bien que la COVID-19 circule encore
While
dans tout le pays,
COVID-19
les
is still
indicateurs
circulating
actuels
across the
d'activité de la
country,
maladie,
current
allant
disease
des cas
activity
signalés
indicators,
quotidiennement à la
from daily
positivité des
reported
tests de
cases
laboratoire,
to laboratory
révèlent une
test
diminution de la
positivity,
transmission dans
indicate
de nombreuses
decreasing
régions.
transmission in many
Les
areas.
données sur les eaux usées montrent également
Wastewater
des
data are
indices d'un
likewise
éventuel
showing signs
plafonnement
of a
ou
potential
d'un déclin
plateau
après le pic dans
or
plusieurs régions.
post-peak decline
Comme
in
notre
several
réseau et
areas.
nos données sur les eaux usées
As our
continuent de
wastewater
se
network and
développer,
data
l'Agence de
continue
la
to
santé publique
expand,
du Canada,
the
en
Public Health
collaboration avec
Agency
des
of
partenaires,
Canada, together with
lancé un
partners,
tableau de bord
has
en ligne
just
pour
launched
afficher les
an
tendances
online
relatives
dashboard
aux eaux
to
usées
display
dans certaines
wastewater
villes du
trends
pays.
in
À
certain cities
l'avenir,
across the
ces données
country.
seront de plus en plus utiles pour
Going forward,
communiquer
these
des
data will be
signaux tels que la
increasingly
présence
helpful
nouvelle ou
for
croissante
communicating
du
signals,
virus.
such as new or
Actuellement,
increasing
les
presence
tendances
of
des
the
indicateurs
virus.
tardifs de gravité,
Currently,
comme les
lagging
hospitalisations,
severity trends,
sont
such as
encore élevés, mais
hospitalizations,
commencent à
are
diminuer
still
dans
high,
certaines régions.
but are beginning to
Néanmoins, les
decline
semaines
in
de
some
résurgence de la
jurisdictions.
COVID-19, y
Nevertheless,
compris la
weeks
propagation de
of
la maladie
COVID-19
et
resurgence,
l'absentéisme parmi
including
les travailleurs
widespread
de la
illness
santé,
and healthcare
ont
worker
contribué à des
absenteeism,
conséquences
has
prolongées sur
contributed
les
to
systèmes de
prolonging
santé.
impacts on the health
Avec la
system.
prédominance de sous-variants BA2
With the
d'Omicron et la poursuite de
BA2
l'évolution du
sublineage
virus
of
de
Omicron
SARS-CoV-2,
predominating
le chemin à
and
parcourir
the
risque d'être semé
SARS-CoV-2
d'embûches.
virus continuing to
Toutefois, avec
evolve,
l'arrivée
the
des
path ahead
températures
may
plus
not be
clémentes,
smooth.
on peut espérer
But
que,
with warmer weather
tout en restant
beginning,
prudents,
it is
nous
hoped
pourrons
that,
profiter d'une
with
période de
continued
faible
caution,
activité
we can
et de
enjoy
temps
a
pour
period of
récupérer.
lower activity and
C'est
some
pourquoi
time
le
for
thème de la
recovery.
semaine de la santé mentale
That is
de
why
cette année
this
est si
year's
approprié
theme of
puisqu'elle met
Mental Health
l'accent
Week
sur la
is so
façon dont
fitting,
nous pouvons
as it focuses
développer
on how
et
we can
améliorer
learn
nos
and
capacités
hone our
d'empathie
empathy
pour nous
skills
épauler
to
les uns
help each
les
other.
autres. L'Association canadienne pour la santé mentale nous
Through
encourage,
this week's
par le biais
communications,
des communications,
information,
de
and
l'information
resources,
et des
the
ressources
Canadian Mental
proposées
Health
cette semaine,
Association
à développer et à
encourages
mettre
us
en
to
pratique ces
develop
compétences
and
en
practice these
commençant par
skills,
nous écouter
starting
les uns
with
les autres sans
listening
nous
to one
juger.
another without judgment.
Autrement dit,
That
l'empathie
is to say,
nous aide à nous mettre
empathy
à la
helps
place
us
d'une
put
autre
ourselves
personne et
in
à
someone
chercher à
else's shoes
comprendre son
and
point de
seek to
vue. Elle
understand
nous aide non
their point
seulement
of
à
view.
tisser les liens entre nous et
This
à
not
nous
only
soutenir
helps us to
mutuellement,
connect
mais
with and
aussi à
support
réguler nos
others,
propres
it can
émotions
also
et
help
à réduire
us
notre
regulate
sentiment
our own
d'isolement.
emotions and reduce
La
feelings of
pandémie a
isolation.
bouleversé nos vies à bien des égards.
The
Certaines
pandemic has
recherches
impacted
suggérant
our lives
que
in
jusqu'à
many ways,
50% des
with
Canadiens
some
ont
research
vu leur santé
suggesting
mentale
that up to
décliner pendant
50%
la
of
pandémie.
Canadians have
Nous
experienced
savons que
declines
ces
in our mental
répercussions ont
health
touché
during the
certains groupes
pandemic.
plus que d'autres
We
et qu'au
know
fil de
that these
l'évolution
impacts
de la
have
pandémie,
affected
nous
certain
avons
groups
été
more than others,
confrontés à
and
différents
that as the
défis et
pandemic has
encore
evolved,
aujourd'hui.
we have
Si
faced
bien des
different
gens sont
challenges,
heureux de voir les
including
mesures
now.
s'atténuer, cela
While many
peut
are happy
aussi
to
être
have
source
measures
d'anxiété
easing,
et de stress pour
this
les
can also
communautés
bring
qui
about
s'adaptent
anxiety
progressivement
and
au
stress
changement.
as
À
communities
l'heure actuelle,
adapt
comme
to the
tout au long de la
changes.
pandémie, Espace
At
Mieux-être
this
Canada
time, as
continue
throughout
d'offrir
the
des ressources
pandemic,
et des mesures de
Wellness Together
soutien
Canada
virtuels et
continues to offer
confidentiels en matière de
confidential,
santé
virtual
mentale et
mental
de
health and
dépendance aux
substance use
substances aux
resources
personnes de
and
tous âges
supports
au
to
Canada.
people of
À
all
ce jour,
ages
près
in
de
Canada.
2,3 millions de
To
personnes
date,
au Canada
almost
ont utilisé ces
2.3
ressources
million
qui
people
sont offertes
across our
gratuitement
country have used
24
these
heures par jour,
supports,
7 jours
which are
par
offered at
semaine.
no
En
cost,
santé mentale,
24 hours
tous
a
les
day,
gestes comptent.
7 days a week.
J'encourage tous les Canadiens
When
à
it
faire
comes
ce
to
qu'ils
mental
peuvent
health,
pour
every
favoriser
action
leur propre
counts.
santé
I
mentale
urge all
et leur
people in
bien-être,
Canada to do what
ainsi
they
que ceux de
can
leur
to
famille
support
et
their
de
own
leurs
mental
amis.
health and well-being
Faire preuve
and that
d'empathie
of
en
their
posant
family
un
and
geste de
friends.
bienveillance
Practicing
envers
empathy
quelqu'un
through an
peut
act of
aider
kindness for
énormément.
someone
Et
can go a long
ensemble, nous
way.
pouvons tous
And
contribuer à
together,
créer
we can
des
all
changements
help to create
positifs
positive
dans nos
change
écoles,
in
nos
our
lieux de
schools,
travail et nos
workplaces,
communautés.
and communities.
Sur la trajectoire de la COVID-19 risque de nous faire connaître
Although we
encore
may
des hauts
experience
et des
further
bas
ups
à
and
l'avenir.
downs
Le
in the
maintien d'une
COVID-19
approche
trajectory going
vaccination
forward,
plus peut nous
maintaining
permettre de
a
rester préparés
vaccines
et mieux
plus
protégés.
approach can
Il
keep
faut
us
donc rester
prepared
attentif
and better
à
protected.
l'activité de la
This
COVID-19
means
dans votre
remaining
région et
aware of
continuer
COVID-19
à
activity
appliquer
in
des
your
mesures de
local
protection
area and
personnelles,
continuing
comme
to take
rester à la
personal
maison si vous êtes
precautions.
symptomatique
For
ou
example,
si vous
staying
recevez un
home
résultat
if
de
you are
test positif,
symptomatic or if you test
améliorer la
positive,
ventilation et
improving
continuer à porter un
ventilation,
masque dans
and
les espaces
continuing to wear a
intérieurs communs
mask
ou
in
les
shared
espaces
indoor
bondés
or
lorsque
crowded
vous êtes en
spaces
compagnie de
when you are
personnes
with
avec lesquelles
people
vous
you
n'habitez
don't
pas.
live with.
Le principe de base de l'approche vaccination
Always at the
plus
core
est de
of
tenir à
Vaccines
jour
Plus
toutes les
is staying
doses
up
de
to
vaccins
date with
recommandées
all
pour vous,
vaccine doses
c'est-à-dire une
recommended for
série
you.
primaire de vaccins
This
contre la
means
COVID-19
a
pour toute
primary
personne
series of
âgée de 5 ans ou
COVID-19
plus
vaccines
et les
for
doses de rappel
everyone 5 years
recommandées
of age
pour
or
les
older,
personnes âgées de 12
and
ans ou
booster
plus.
doses as
Alors
recommended
que nous
for those
reprenons
aged 12
davantage
years or
d'activités
older.
et de rencontres au Canada
As
et
we
dans le
resume
monde,
more
d'autres
activities and
maladies
connections in in
infectious
Canada
graves
and
comme la
around the
grippe et la
world,
rougeole
other
font un
serious
retour
infectious
en
diseases
force.
such as
Le Canada
influenza
a
and
signalé
measles
une
are making a
augmentation de l'acte
comeback.
activité
Canada
grippale
has
au
reported
cours des dernières
increased
semaines
influenza
et
activity
l'Organisation
in recent
mondiale de la
weeks,
santé
and the
a
World Health
signalé une
Organization has
augmentation
reported
de
a
79% des cas de
79%
rougeole dans le
increase
monde
in
au cours des 2
worldwide
premiers
measles
mois de cette
cases
année
in the
par
first
rapport
2
à
months
la
of
même
this
période
year
l'année
compared to the
dernière.
same period
Comme il
last
s'agit
year.
des maladies évitables par la vaccination,
As these
les
diseases are
vaccinations
preventable
tardives
by
ou
vaccines,
manquées,
we
en
know
particulier
that
pendant la
delayed or missed
pandémie, sont un
vaccinations,
facteur majeur de
particularly
ces
due to the
tendances à la
pandemic, are a
hausse.
key factor
Quel que soit
in
notre
these rising
âge, nous
trends.
devons tenir nos vaccins
No
à
matter
jour
what our
tout au long
age,
de
we need to
notre
keep
vie.
vaccinations up to
Intégrez la
date
prévention
throughout
dans
our
votre plan
lives.
de santé
Make
en
prevention part of
consultant
your
votre
health plan
professionnel de la
by
santé
checking in with
ou
your
les
health
ressources
provider
locales en
or
matière de
local
soins de
healthcare
santé.
resources.
Merci.
Thank you.
Thank you, Miigwech.
Merci au docteur. Nous allons
Thank
passer
you,
à la période de
doctors.
questions. Un rappel
We'll
de
now move on
lever
to
la main
question
sur
period.
Zoom si vous avez une question. Et nous
Just a
avons
reminder,
jusqu'à
please raise your
midi,
hand
en
on
fait,
Zoom if
pour les
you have a
questions. Donc, on
question,
va en
and we
passer
have
le plus
until
rapidement possible. So we're
noon for
going to
questions.
go to questions. A reminder to use the raised hand function if you do have a question on Zoom. And we have a hard stop at 12, at noon, actually. So we are going to take as many questions as possible, always a priority to members, and then alternating between English and French. Alors, on va commencer avec Dylan Robertson, Winnipeg Free Press.
Hi, Dr. Tam. Thanks for taking our questions. I'm wondering what the articulated goal of the booster campaign is. If the chief medical officers of health have set a goal in terms of getting a certain percentage of the population boosted, or if it's something more like allowing access to all the priority groups under NACI within a certain timeline.
Thank you for that question. So the Chief Medical Officers of Health together released a statement quite recently recommending up-to-date vaccination based on the recommended recommendations of the National Advisory Committee on Immunization. I think obviously it was very important for those in the highest risk groups to get the boosters. And we know that they're doing quite well in terms of the most seniors of our population, but there's still some gaps in vaccine coverage for the booster dose for those between 50 and say 69 years of age can do a lot better. Of course, NACI also strongly recommends that anyone 18 years of age or higher go and get a booster. And even if you got infected, you can wait 3 months and get your booster.
Good stuff. I didn't hear an articulated target there, so I'm not sure if there is one, but I'm also wondering about the prevalence of long COVID. Public Health Ontario put out some pretty scary numbers in terms of how many people get symptoms that would be classified as long COVID. I wanted to know what your understanding is of how likely someone who gets infected today is going to end up with long COVID, and if you feel like that risk is articulated enough in the booster communication campaigns.
Thank you for that question, and that's a very important question. I think we are still trying to understand long COVID more, including the prevalence of long COVID post-infection. And there's various estimates. I think that at the WHO, estimates, the earlier estimates put it at 10 to 20%. But we know that more recent estimates have put it at maybe as high as 50% for those who have been infected with COVID-19. We also don't understand enough, perhaps, about how the different variants can impact long COVID. So there's much research remains to be done. So one of the first things that the Public Health Agency, together with Statistics Canada, is doing is a survey that's ongoing right now to try and get a much broader population level view of the prevalence of long COVID or post-COVID condition. The CIHR is launching or has been doing supporting research and also got some recent support in the recent budget of $20 million to continue doing more research in this area. So I think in summary, though, even now, we probably anticipate that the impact of long COVID is going to be quite substantial. And there's a huge range of symptoms that people are trying to understand. There's over 100 of them. there may be different underlying pathophysiology or pathogenesis for some of these symptoms that still has to be further understood. But I think while the data is relatively scant, there's emerging data to show that vaccines are able to provide a level of protection against long COVID. Some studies put it at 50% effectiveness. That still has to be further studied. But I do think that the vaccine plus approach is still the way to go. We could do more, I think, in communicating the importance of getting vaccination for the reduction of the risk of long COVID. But as you can see, the data is emerging. If you don't get COVID, of course, if you're prevented from getting COVID, then you, of course, have less. You don't have a risk of getting long COVID if you didn't get COVID in the first place. So that's just a fundamental principle.
Émilie Bergeron, La Presse canadienne.
Oui, bonjour, Dr. Tam. Vous
Yes.
avez mentionné en
Hello, Dr.
ouverture
Tam.
qu'il
In
y
your opening
a, que vous
remarks,
constatez
you
une diminution
mentioned
de la transmission dans plusieurs régions.
that
Est-ce qu'on
there's
peut
a
parler
decline
dans ces
in
régions-là
spread in many
d'un creux de la
regions.
sixième vague ou même qu'on
Can
se
we
dirige vers la
say
fin de
then
cette
that
sixième vague?
we're seeing the end of the sixth wave in those regions?
C'est Dr. News,
This
Dr.
is
Tam
Dr. New,
veut dire quelque chose aussi, mais
and
comme
Dr.
on a
Tam may wish to
mentionné, je
add
pense
something
que
as well.
c'est difficile à
As we
parler pour
mentioned,
tous les pays, mais je
it's
pense
difficult to speak
qu'en
for the
général, on peut dire
entire
on a
country,
pas
but
mal
we can
proche
speak
de le
in
pic, on a
general
même
terms.
dépassé le pic, le sommet
So
de la
we can
sixième
say
vague
that
ici au
we
Canada.
are
Mais
past
ça
the
dépend parce que
peak
dans plusieurs régions,
in many
quelques-unes
regions of Canada,
ont
but it
déjà peut-être
depends.
dépassé le pic, quelques-uns
Some
sont
regions
jusqu'au
have
au
passed
moment
that
de
peak,
peut-être atteindre le pic de
and other
leur
regions have yet
courbe
to
épidémique.
reach
Mais
the
je pense
peak
en
for the
général,
sixth
aussi
wave
avec
in
les
their
températures plus
epidemiological
clémentes,
curve.
on a dans une
The
meilleure
warming weather
situation
is
maintenant
also a
aujourd'hui
factor,
qu'avant.
so we're in a better situation now than we were before.
OK, merci. Et est-ce qu'on peut
Thank
conclure,
you.
justement, vous parlez de,
As a
vous
follow-up question,
évoquez la saisonnalité. Est-ce
can we
qu'à ce stade-ci,
conclude,
on peut
and you're
conclure
mentioning the
avec les
warming
études qui
weather,
existent
can we
que
conclude, looking at studies
il y a
that have
vraiment
been
une
done,
saisonnalité qui vient avec la
that
transmission de la
there
COVID-19,
is a
c'est-à-dire que quand il
seasonal
fait plus chaud,
aspect to the spread of
il y a
COVID. That is to
nécessairement
say
moins de cas.
that
Est-ce que
when
la
weather is
science s'est
warmer,
rendue là?
there are fewer cases. Has science led
Merci
us
pour la
to that
question, c'est Dr.
conclusion?
New. Je pense qu'on
Thank you for
continue
that
à
question. This
apprendre
is
des
Dr.
choses
New.
sur la
We
COVID-19 et
continue
peut-être c'est
to
un peu
learn
plus
things
trop tôt
about
pour
COVID-19,
prononcer sur
and it
ce
may
fait,
be
mais avec
still too early
l'expérience des
to
vagues
speak
précédentes, c'est
to
sûr
that.
on a
But
vu
if we look at
que
earlier
pendant
waves,
l'été,
we certainly
il y a
did
moins
see
comme d'activités,
that
moins
there
de
was
transmission. Je
less
pense que aussi
activity and
parce
less spread
qu'avec
in summertime.
comme nos étés peut-être un peu plus courts ici au Canada,
In
tout le monde
Canada,
profite
our
d'être à
summers are perhaps
l'extérieur. On sait aussi
shorter,
avec
but we do
la
spend more
science et
time
les
outdoors.
données probantes
And
jusqu'à
we know,
date que
based on
c'est
science and
toujours, comme on dit,
evidence
toujours en
to
français,
date,
aussi en anglais, le bec
that
et aussi le triple C en anglais, que dans des lieux
we
bondés aussi
can
avec des
use
contacts
the
étroits et
3
des
C's
espaces clos.
approach.
Ça,
So
c'est
for
toujours
closed
les facteurs
spaces,
importants pour la
crowds, and
transmission.
other
Donc, on
factors,
sait que
those are always
normalement,
important
avec
factors
le
to keep
retour à
in mind.
l'école et quand les
And
gens
also,
commencent à
we know that going
rentrer à
back to
l'intérieur,
school
que
is an important time
l'activité
of
et
year for COVID
les infections
because when
augmentent pendant
people return
l'automne et
to the
l'hiver. Donc,
classroom
je ne sais
in
pas ce que
the
c'est
fall
vraiment une
and winter,
saisonnalité, mais on
COVID
sait que les
cases
facteurs
have been
pour la
known to
transmission,
increase.
c'est plus important pendant la saison que
So
les gens sont plus à
transmission
l'intérieur
is
que pendant
higher in
l'été
seasons
quand
when
il
people
y a
tend to be
beaucoup
indoors
plus
more
de gens qui
often
sont à l'extérieur.
rather than in the summer when people are
JP
outside.
Tasker, CBC News.
Hi, doctors. Yeah, Dr. Tam, in March, you said the government is reviewing all vaccine mandates, including those for federal public servants and travelers. Can you give us an update on that review? What do you think? Are mandates here to stay?
I think you best ask the Treasury Board president, but it is my understanding that the review is still ongoing.
I want to ask you about this mysterious liver disease that we're seeing reported in some kids. Hundreds of cases have been reported worldwide. Acute hepatitis, I guess, is what they're calling it. What do we know about this? And is there any indication that this is somehow tied to COVID? I know in Israel, some of the cases that have been reported were in kids that have had COVID.
Yes, this is something that globally there's been some signals of hepatitis cases occurring in children that we've been made aware of for sure. And in Canada, we've contacted pediatric hospitals, 17 pediatric centers, to see if we can get a better understanding of what's going on in Canada. Overall, I think we're still at the investigation stage of trying to figure out whether any of these cases are indeed linked at all. There's always been hepatitis and some severe cases of hepatitis in children pre-pandemic, and one would expect post-pandemic as well. And certainly in the countries similar to Canada, about 50% or thereabouts of pediatric hepatitis cases that are severe have no known cause, even before the pandemic. So I think right now we're doing disease detective work, looking at time, place, person who is being affected, so that investigation is ongoing. We've linked with our provinces. We've set our case report forms and definitions. So we might expect to hear about some cases in Canada, and they'll be called probable cases because there's no confirmation as such on the specific cause. So it's really casting the net wide and then homing in to see if there's any commonalities or common pathogens. I know that in the United Kingdom and in Alabama in the United States, there's been some detections of adenovirus type 41, but that may or may not be the cause or the only factor leading to hepatitis in children. And so I think stay tuned. Of course, we'll provide further information as we go along, but we don't have I don't think we've solved the underlying cause for these cases at all.
Yeah. It's Dr. New. The only additional point I would add is, as Dr. Tam has said, is that we've worked closely, or we are working closely with the provinces and territories. We set up a surveillance system here in Canada, and the case definition we're using is broad and similar to the WHO. It's really looking at all acute hepatitis cases among individuals less than 16 years of age, casting a wide net, and only those that sort of have been proven to not have sort of the usual sort of causes, viruses, hepatitis viruses A to E, and obviously with indications of abnormalities, inflammation of liver, as signaled by sort of an increase of liver enzymes. So it's quite a broad case definition, and certainly any of those that we capture, we'll take a closer look with the experts to see if we can find a potentially a common cause. But at this point, we're still looking, obviously, in Canada, and we anticipate that there might be situations or cases coming forward that would meet that broad case definition.
Raymond Filion, TVA.
Bonjour, Dr. New. Merci de prendre nos
Good day,
questions.
Dr. New. Thank you for taking
Avec
our
l'annonce du Québec
questions.
cette semaine, dans quelques jours, toutes les provinces au
This year,
Canada
Quebec
auront levé
announced,
l'obligation de
this
porter le
week,
masque
Quebec announced
dans
that
presque tous les lieux publics.
the mask
Qu'en
mandate
est-il
will
du
be
fédéral?
lifted in
Qu'attend le
almost all
fédéral
public
pour
spaces.
faire la même chose?
What will it take for the federal government to do the same?
Merci pour la question. Comme
Thank you
Dr.
for the
Tam a
question.
constaté, c'est un enjeu
As Dr.
actuel
Tam
et
noted,
c'est le
this is
Conseil
a
des
current
Trésors
issue,
qui continue à faire
and it
leur
is the
analyse, et
Treasury
je pense
Board that
va peut-être
is continuing to carry
prononcer sur
out
peut-être
assessments
la
on
politique
that
à
matter.
l'échelle fédérale, mais d'après
They will
moi,
be the one
on
to
a
make a decision on the federal
répété à
policy.
plusieurs reprises que même s'il y a un
But
mandat
as
ou
we
non
have
dans une
repeated
province ou
ad
territoire,
nauseum,
dans une
even if a
région,
province,
n'importe où au
territory, or
Canada, je
any
pense que
region anywhere in
le port
Canada
de
lifts the
masque,
mask
c'est une
mandate,
mesure de protection individuelle qui c'est
mask wearing
important. Et si si
remains
on se trouve
an
dans
important way to protect
un lieu
ourselves and
bondé,
others.
un espace
For
clos aussi
example,
avec un
if we're
contact étroit
in
avec
close
d'autres personnes
contact
qui
with
ne
other
font pas
people
partie
or in a crowded,
de
especially
votre
indoor space,
ménage, c'est très important
with
peut-être
people
comme
who
une
we do not
mesure
live
de
with,
protection
this
individuelle, mais une
is
autre
a way to be
considération, c'est
cautious,
pas seulement
and
pour
it
se
is a means
protéger,
of
mais aussi
personal
pour
protection,
aussi considérer
not
peut-être les
only
autres
for
personnes
ourselves,
peut-être
but
vulnérables,
also taking
immunodéprimées.
into
C'est aussi
consideration
une geste,
other vulnerable
d'après moi, pour
individuals, people who
aussi
are
respecter, aussi
immunocompromised, and it
protéger
is
les
a way
autres.
to respect and protect others.
Donc oui, je comprends qu'il y a une étude du cas
Thank you.
qui
So
est
I
actuellement faite par le
understand
Conseil du Trésor, mais
that
vous,
the
en tant
Treasury
que
Board
médecin
is
fédéral,
currently
en tant que
carrying out
scientifique,
that study, but
pouvez-vous nous dire à
you,
quel moment
as
ça,
chief
ce
scientist in the
serait, on peut
government,
penser, qu'est-ce que ça va prendre pour que ce soit
can you
enlevé dans les transports et dans,
let
dans
us know what
les
you
édifices
think it would
fédéraux comme le
take
Parlement,
for
par
the
exemple?
mask to
Quand
be
seriez-vous prêt, vous, à
lifted, mask mandate
recommander
to be
que le port
lifted
du masque ne soit
in
plus
public
obligatoire?
spaces, including on Parliament
Merci.
Hill and
Je
other
pense que
public
c'est une
spaces?
bonne distinction. Nous
Thank
autres,
you for
Dr.
the
Tam et
question.
moi et les autres experts, on fournit toujours, comme il dit,
Dr. Tam,
les
myself,
données
and other
probantes,
experts
l'évidence,
always base ourselves
la
on
science concernant
evidence
le risque
and
de
science
transmission, c'est quoi
concerning
aussi
the
l'importance ou
risk of viral
l'efficacité
spread.
des vaccins
And we look
contre
at the
l'infection aussi, ou
effectiveness of
peut-être contre les
viruses
maladies à des conséquences
against
graves de la COVID-19. Et
infection
puis
and
après, c'est
against
vraiment pour les
severe
décideurs de
illness
prendre tout
with
ça dans
COVID-19.
l'ensemble avec peut-être
It
les autres
sometimes can be
considérations
difficult to
pour
look at all of
modifier,
this information as a
changer ou
whole and
peut-être
also
continuer
factor
à
in
garder la politique.
social
Mais
measures.
pour nous autres, c'est toujours question de
But when it
fournir
comes to us,
les meilleures
our job
sciences et
is to
les
provide
données
the best science
probantes à date.
and evidence possible to date.
Glenn McGregor, CTV News.
Yeah, hi. Thanks. Dr. Tam, on the vaccine mandate for air travelers, you've said in the past that this is an issue should be decided by policymakers, but they take your advice on this and say that they make their decisions based on science. So given the limited effectiveness in vaccination and reducing infections, and the fact that other countries are abandoning this requirement, what is the rationale for continuing to require domestic air travelers to be vaccinated before boarding? And what is your advice to government on this?
So the data is showing that 2 doses of vaccine, indeed, in the Omicron wave, so the Omicron is the sort of game changer, has shifted the vaccine effectiveness. And so 2 doses has very limited ability to reduce infection and therefore transmission. And so that is actually very low after 6 months. But a booster dose, of course, boosts that up to, an average, there's different studies, different results, but an average of 60% protection, which also wanes over time. So it's not that there is no protection, it's imperfect protection. Which is why we recommend layering the masks, because the vaccines alone will not be able to completely or in a significant way, maybe to reduce transmission. But each of them adds a layer of protection. But it is quite clear that 2 doses, as is currently defined in the policies, need to be re-examined. And so that those kind of data, of course, has been provided to the policymakers.
You mentioned the increase in measles cases reported by WHO. Are we seeing that here? And if so, are you concerned that this is a consequence of the politicization of vaccination over COVID-19 spreading to vaccination against other illnesses? I mean, are you seeing declining rates of vaccination that we've been taking for decades here in Canada? And is that contributing to possible increase in other illnesses like measles?
Well, I think the vast majority of children in Canada were vaccinated against measles and other highly contagious infectious diseases prior to the pandemic. And so there's always pockets of vaccine hesitancy, lack of vaccine confidence, which we've been tackling before the pandemic. During the pandemic, the issue we are most concerned with is people not having had access to vaccines during the pandemic needs to catch up. So people who were not able to get an appointment or forgot to get their kids up to date with a vaccination should do so now. Because as society opens up and there's increased mixing, the risk is going to increase for all sorts of infectious diseases that are transmitted by respiratory routes and others. And people are traveling. So right now we do not have reported measles cases, but if people were to travel, that's definitely a risk. So definitely get up to date before travel. Canada had eliminated domestic measles prior to the pandemic, and we need to keep it that way. But the vast majority of parents and children are supportive, and they've been vaccinated before. I don't see why we couldn't go back to get that level of vaccination now.
Laurence Martin, Radio-Canada.
Oui, bonjour, est-ce que vous m'entendez bien?
Hi there, can you hear me?
Oui.
Yes, we can.
Excellent. Je me demandais, comme vous dites que justement on arrive dans la saison estivale
You
et
were talking
qu'on s'attend
about
à ce qu'il y ait
how
une baisse des
summer
cas
is
cet été,
here
est-ce que pour la
and you're
quatrième dose,
expecting
donc pour les gens qui ont déjà eu une
lower
troisième dose et qui
cases
veulent aller
this
chercher donc leur
summer.
quatrième dose, est-ce
Now,
que
for
vous recommandez
Canadians
d'aller
who
la
want to
chercher
go and get
maintenant
their
ou
fourth
plutôt d'attendre
dose,
peut-être à la fin de l'été
when do you
quand on
recommend
est
they get
justement près
that?
de
Should they wait
l'automne
until the end of
pour
the
aller
summer when
la chercher,
autumn is
sachant que
around
c'est
the
vraiment à
corner to
l'automne et
go
à
and
l'hiver
get
qu'en
that
général
next
on voit
booster,
davantage une recrudescence
given
des cas.
that usually we see that wave rise
C'est Dr.
in the
New.
colder
Merci pour
months?
la question. C'est une
Thank you
bonne
for the
question. Je
question.
pense
This is
qu'en fin de
Dr.
compte,
New. That's a good
c'est
question.
toujours comme il dit une décision
I think
personnelle.
at the
Je
end
pense
of the
que chaque
day, it is
personne
always
doit
an
peut-être
individual's
avoir une bonne discussion
decision.
avec
I
une
think every
professionnelle
person should have a
de la santé parce
conversation
que
with their
nous
healthcare
autres, si
provider.
on parle à l'échelle de la population, notre comité consultatif
If
national de
we look
l'immunisation,
at
on a
the
déclaré,
population writ large,
c'est quoi les groupes admissibles pour une
we
dose de
know that our
rappel, et
National
on parle
Advisory
toujours que
Committee on
c'est important
Immunization
pour tout le
has
monde si on est
defined
admissible de
which
recevoir
groups
une dose de
are
rappel. Et
eligible
maintenant, même pour
for
les populations
vaccine
plus vulnérables,
booster
c'est une
doses
bonne idée,
and
même
when.
comme on dit, une quatrième dose si on est très âgé
And
avec
we know
peut-être
it
des
might
autres
even be
conditions et
necessary
vous êtes
to
plus à risque.
receive
Mais
a fourth
je pense
dose,
que c'est quelque
especially
chose,
if
c'est aussi
you're part of one of these eligible
quelque chose à
groups, such
discuter,
as
mais
senior
je pense
citizens,
que
etc.
finalement, c'est souligne l'importance de la vaccination et toujours être à date, on dit,
It
avec
is
à
extremely
jour
important
avec
for
les vaccinations. Je
vaccines
pense que
to be
si on
kept
parle
up
d'une
to
quatrième
date.
dose, je pense qu'il faut aussi
Regarding a fourth
parler du
dose,
fait
again,
qu'il existe encore, je pense, peut-être 4-5 millions
I think there are
de personnes
still
admissibles au Canada
4 to
qui n'ont
5
pas
million
complété, même
eligible
reçu peut-être
Canadians
une première dose
who are
pour
still not fully
compléter leur série
vaccinated. Some
primaire
of them
qui sont
still do not
admissibles
even
pour la
have their
vaccination. Donc, je
first
pense qu'il
dose
faut encore peu
of
de
the
travail pour
COVID-19 vaccine.
assurer que tout le monde a
And this is
reçu au moins
important
la
work
troisième dose, peut-être
to make
si
sure
on est admissible,
everyone
parce qu'on
has
recommande en
their
général
vaccine
tous les
doses.
adultes
We recommend
de
that everyone
18 ans et
have at
plus en
least
général
3
de recevoir
doses.
une dose de rappel. C'est sûr que c'est plus important pour les personnes plus âgées, plus
And it's even more
vulnérables, mais
important
pour une quatrième dose,
for
je pense que
older Canadians
c'est aussi
and
quelque chose à
vulnerable
discuter,
groups.
mais on regarde parce qu'il y a
This is
quelques
something
mois
important to
jusqu'à
discuss.
l'automne, et c'est sûr que peut-être avec l'évolution, avec les variants, je sais aussi que les
The
compagnies
variants are evolving,
pharmaceutiques continuent
and we know
peut-être
that pharmaceutical
faire des
companies
expériences, peut-être même
continue
modifier
to
leur vaccin
carry out
pour l'automne,
experiments to
peut-être plus
develop
visé
new
contre les
vaccines
variants. Ça, c'est le
to
futur.
try
On
and
n'a pas
come
une
up
boule
with
de
a
cristal,
vaccine
donc je
that will
pense
be
pour
effective
l'instant, c'est
against
toujours important
variants.
de peut-être assurer qu'on a une bonne
For
couverture
the time
vaccinale pour
being,
une
it is
troisième
very
dose. Et
important to make sure that we
pour une
have
quatrième
good
dose,
vaccine
oui, si
coverage. That
on
means
est
that we have at
admissible,
least 3
sûrement,
vaccine doses as
c'est important de
recommended.
peut-être discuter avec votre médecin
And
et
it is
peut-être
wise
si
to discuss this
vous
matter
êtes
with
admissible,
your
c'est toujours une bonne idée
healthcare
de
provider.
toujours être à
And
jour
if you are
avec la
eligible,
vaccination.
make sure that you get your next
OK.
dose.
En tout respect, je trouve ça un petit peu mélangeant parce que c'est une
Thank
question
you.
que je me fais poser
With all due
souvent. Puis
respect,
je me demande juste
I am
si,
somewhat
Dr. Tam aussi, je ne sais
confused.
pas si vous voulez intervenir par rapport à
And
ça, mais
perhaps Dr.
j'essaie
Tam
juste
would like
de
to
comprendre,
step
est-ce
in.
que quelqu'un qui est, par
What I'm
exemple,
trying to
disons, qui
understand is
n'est pas
this.
vulnérable en ce moment, là, qui n'est pas
Imagine
très âgé,
we're talking about
qui
an
n'est pas,
individual who's not
comment dire, qui n'est pas
vulnerable.
immunosupprimé.
They're
Est-ce
not
que cette personne-là doit, parce que, par exemple, au
immunocompromised and
Québec,
they're
la quatrième
not
dose, on peut
a
aller la chercher.
senior.
Est-ce que Cette personne doit
Are
aller
they
la chercher
able
tout de suite ou elle
to
doit attendre à la fin de l'été
get
pour
their
aller la
fourth
chercher?
dose? And if they are, should they wait? Should they wait until the end of the summer
Je ne sais
to
pas,
get the
Dr.
fourth
Tam,
dose?
peut-être si vous voulez ajouter.
Dr.
Moi, je
Tam,
pense
I'm
que
not sure if you'd like to
c'est
add
toujours important
something.
le couverture
Dr.
vaccinale
New
pour une
here.
troisième dose.
I think it's
Quatrième
always
dose, je
important
sais,
to have our
le
third
Québec
dose.
rend plus accessible
I know that Quebec is
à la
making the fourth
population au
dose
Québec
more
de
available
recevoir
to
une
Quebecers.
quatrième dose. C'est sûr qu'avec une quatrième dose, on peut avoir, comme on dit,
And
une
certainly,
augmentation
with
des
a fourth
anticorps pour un bout de temps,
dose,
peut-être pour mieux protéger contre
antibodies will
l'infection. Et aussi, c'est
increase
toujours même
and
avec une
will
troisième
help
dose, c'est
prevent
un bon
infection
niveau de protection
for
contre
a
les
given period
conséquences
of
graves. Et
time.
peut-être
And
même
it is also a
avec
very
une
good
quatrième
way
dose, ça peut augmenter
to
un peu plus, mais
prevent
on
severe
sait que
illness.
l'immunité, la protection des vaccins, c'est diminue avec le
We
temps.
know
Donc,
that
c'est
vaccine
quelque chose peut-être que
effectiveness
ça
and
donne
immunity decreases
peut-être un
over
peu
time.
plus de protection pour un bout de temps, mais
So
en automne,
vaccines are a way to
on
boost our
sera encore
immunity
peut-être,
for a limited amount of
comme on dit,
time.
plus vulnérable pour les variants qui peut-être vont être émergents en automne et
It is
peut-être on va
possible
parler
that
de
a new
notre dose de
variant or
rappel ou
new
peut-être un
variants
autre
will emerge in
vaccin
the
plus visé
fall,
contre les
and
variants.
perhaps we will see a more targeted vaccine
Laura
be
Osmond, Canadian
developed.
Press. Laura, are you able to unmute yourself?
Yeah, sorry about that.
worries.
Good morning, doctors. I wanted to follow up on what my colleague Dylan was asking about long COVID. You mentioned that there is a survey to try to figure out how widespread this issue is. What are the difficulties in identifying these people in the healthcare system itself, that we're not able to get those numbers directly from our health systems in the same way that we do with COVID cases, for example?
Thank you for the question. I think getting a broader representative snapshot is a really good methodology. I think it should be used alongside other methods of case ascertainment. I think given there's a number of clinics that are being stood up to pay particular attention in a multidisciplinary way to serve patients with long COVID, those are also centers where information about the cases could come forth. But I think this just adds another methodology to help us gain a broader and better look. But I think each of those methods are supplementary. But of course, long COVID symptoms can be quite broad and non-specific. And so depending on the questions and the questionnaires, you might elicit different answers. So I think that's part of it too. And the survey itself was designed to not just get at this particular question, but to take another snapshot of the actual seroprevalence in the population and being able to unpack other disaggregated information, such as, of course, geographic location, but it may help us understand whether there are subpopulations that might be more impacted than others as well.
That's great. I'm also curious about the implications for individuals who might have a hard time identifying whether they have long COVID, particularly if they never received, a PCR test or even a rapid test result, and whether that might have implications for things like filing claims for health coverage or time off work or that sort of thing. The fact that this is difficult to identify, what are some of the implications of that?
Well, I think as all things public health, these are very complex issues. And I think the points that you brought up are very understandable. I think there's been discussions by patients with living experience with the relevant departments in charge of social policies. And I think given the potential lack of data or the challenges that individuals might have, these need to be taken into account and make sure that we do have equitable access and to care and support for individual patients. I do think it would be quite difficult to tease out. In the study contexts, when we are looking at seroprevalence, for example, there are different methodologies with antibody responses. More than one test are being applied to try and get a better handle on whether people got past infections. So with that in mind, I think the survey will give us a better understanding of the application of really what has been sort of research tools in antibody data on past infections. And maybe even out of that, there could be more diagnostic tools that could be useful for people with long COVID or potentially have long COVID. We do need actual diagnostics, and that's what the research is all about, is to find actual diagnostics or markers for long COVID impacts.
Annie Guillemette, Cogeco.
Bonjour, vous m'entendez bien?
Good day. Can you hear
Oui,
me?
on vous entend.
Oui.
Yes, we can.
Je voulais vérifier, Dr. New,
Dr. New, I
concernant...
wanted to check something with
on a
you.
beaucoup, dans les 2 dernières années, là, voulu savoir
past
qui entrait
2
au pays
years,
avec quel type de COVID
We've
pour
been
faire le
following
suivi, entre autres,
who
sur les
entered
variants.
Canada with which
Le
type of
gouvernement voulait ça,
COVID,
les
and
spécialistes
we kept
voulaient
an eye
ça, et est
on
arrivé,
variants.
entre autres, les
The federal
contrôles
government was monitoring
de
this,
tests et la fameuse application
and
Arrive-Can.
the
À l'heure
testing
actuelle,
mandate
est-ce
was
que
in place
cette
at airports, and
application-là
also we
est
had
encore
the
de mise
ArriveCan
au
app.
Canada est-ce qu'on en a encore besoin du
Do
côté
we still
scientifique
need
pour
the
savoir ce qui se
ArriveCan
passe
app, scientifically
concernant la
speaking,
COVID-19?
to follow COVID-19?
C'est Dr. New. Merci pour la
This is
question.
Dr. New. Thank you for
Oui,
the question.
si on parle de l'application ArriveCan, c'est comme un
Regarding
outil
the
pour aussi
ArriveCan app,
gérer, comme on dit,
that is a tool
l'arrivée, aussi avoir les
to
données
manage
nécessaires pour
arrivals
les
in
voyageurs qui
Canada
arrivent au
and to
Canada. Mais je pense
have
que la
the
question pour le
necessary data on
dépistage à
people
la
arriving in
frontière,
Canada.
ça reste toujours
But there's also
un
testing
important
at the border.
comme des composantes de notre
And those remain
système
important
de surveillance
components
ici au
of our
Canada, parce
monitoring
qu'avec les
system here
variants
in Canada.
préoccupants, c'est sûr, ça peut
Because
peut-être
with
être
the variants
émergent
of
ici au Canada,
concern,
mais avec
we know
les
that
données
there certainly could
on a
be new
reçues à
variants
date, c'est
emerging
évident
here in
qu'on a
Canada.
détecté, signalé les variants parmi les voyageurs
And we're
qui
able
sont
to detect
d'origine
cases
dans des
in
autres pays.
travelers
Donc, je pense que
who come from different
même si
countries.
on continue d'une façon, je pense que c'est dépistage aléatoire.
So
Ça
even if we
continue
were to
d'être
continue
une
this
composante
random
importante
testing,
pour signaler,
that would
détecter
itself
les
be a
variants
very important
préoccupants
component to help
de
us
l'étranger.
detect
Mais c'est
variants
toujours
of concern
encore
arriving
important
in
de
Canada from
continuer avec
abroad.
la surveillance ici
It's very
au
important to
sein du pays
continue
pour
monitoring
aussi
here
détecter
in
ici. Il y
Canada
a aussi une variant
to
préoccupant émergent
ascertain
ici au Canada.
whether a variant of concern is
Merci.
emerging here.
Concernant
Thank
le
you.
port du masque dans les
As a
transports,
follow-up question,
trains, autobus,
regarding
avions,
masking in public
tantôt vous
transit,
avez dit,
so
ben, il faut
buses,
continuer à le
trains,
porter
and airplanes.
parce qu'il n'y a pas de distance sociale, c'est toujours
You
compliqué, il faut avoir une
mentioned how
personne à
important it is
risque,
to continue
mais
wearing
ça
those
n'arrivera jamais qu'il va y
because
avoir de la distance
people are
sociale
in
dans les
such close
transports en
quarters
commun.
and
Est-ce que,
other people could be
en fait, ce que j'aimerais
immunocompromised.
savoir, c'est quels
And
seront
it's
les
never going to be the
critères
case
pour
that there will
laisser
be
tomber le
zero
masque? Est-ce que ce
people
sera
in the
la
plane who are
quasi-fin de cette pandémie-là de
immunocompromised.
COVID ou vous allez prôner de le conserver
What is
tout
your
le temps parce
recommendation?
qu'il y
Will
aura
you
d'autres
recommend
maladies
to
et d'autres
continue
éléments qui seront
masking
importants?
even after the end of this
Merci
pandemic?
pour la question. C'est
Thank
sûr,
you
comme
for the question.
on a vu avec la pandémie, avec les bonnes pratiques, même
During
comme
the pandemic,
le port du
we
masque,
saw that
les taux
best
des
practices
autres
such as mask wearing
infections, même la grippe et tout ça, a
led to a
beaucoup
decrease
diminué pendant la
in
pandémie.
illness
Peut-être
rates,
c'est quelque
even
chose
for the
comme un
flu
comportement,
and
une
other
habitude. C'est peut-être
sicknesses.
une bonne habitude à garder même pour
It is a good tool,
les
and
années à
yes,
venir,
perhaps
les
it
hivers à
is
venir
a
pour la
wise
saison
practice
des
to
infections
hold on to
respiratoires.
in the
Donc, ça,
future
c'est
to
un
protect
aspect.
ourselves against
Si on parle des
respiratory
transports
illness.
comme les avions, tout ça,
As
comme
it
Dr. Tam
pertains
et
to
moi, on a déjà
airplanes and
constaté,
other modes of
on fournit
transportation, as
les
Dr. Tam and I
données
have already
probantes, qu'est-ce qui se
mentioned,
passe avec la situation
we're looking
épidémiologique
at
ici au Canada, aussi à travers le
evidence
monde.
on the
C'est quoi les
epidemiological
risques de
situation here
transmission?
in
Et on
Canada
sait
and
avec la
around the world
COVID-19, c'est
to
toujours, comme
determine
on dit,
what the risk of transmission is.
très, très transmissible avec les variants qui sont actuellement en
COVID's
circulation
variants
comme
remain
Omicron.
highly
Donc, c'est
transmissible,
toujours important
namely the
d'avoir
Omicron
plusieurs
variant.
couches de protection. C'est
So
sûr
it
que
remains
les
important
vaccins
to
donnent
use
une bonne
various
couche de protection,
levels
mais
and
comme
layers
Dr.
of
Tam a aussi
protection,
dit aujourd'hui, l'efficacité contre
including
l'infection, c'est pas
masking.
à 100%. Donc,
And as
les
Dr.
autres
Tam
couches
mentioned
comme
earlier
de
today,
protection, comme le port de masque,
no one
si on
form
est
of
dans un
protection is
espace clos avec
100%
des autres étrangers
effective.
pour
So
un bout
if
de
we're
temps, c'est
indoors in an
quelque
enclosed
chose
space, in close
qui
quarters
a
with a
une
crowd of
certaine
people,
efficacité, mais la décision, la
vaccines are
politique, c'est
effective, but
vraiment pour les
only to a
décideurs.
certain
Dr. Tam
point.
et moi,
This type
on
of
fournit
policy call is
l'évidence
for decision
scientifique, les
makers.
données
But
probantes
when it comes to Dr.
concernant le
Tam and
mode de
myself,
transmission, les
we
risques de transmission,
provide evidence,
l'efficacité des vaccins.
data, and
Et
science,
c'est les décideurs qui prennent tout ça dans
and we
l'ensemble
provide
avec les
that
autres
to decision
considérations
makers who
pour
take it all into
peut-être
consideration,
changer,
factoring
modifier,
in
garder
other
la politique.
situations as
Mais nous
well
autres,
to
moi, j'ai
land
déjà
on
dit
the
plusieurs
best
fois que
policy.
même s'il n'y a pas comme un mandat pour le port de masque dans
As I
un
have
avion
said
ou
a number
un
of
monde
times,
vaccinal,
even
c'est
if there
toujours une
is
bonne
no
idée
mask
pour
mandate
tout
for
le monde
airplanes or other
toujours
modes of
être à
transportation,
jour avec leur propre
it
vaccination
is still a
et
good
aussi
idea
comme
for
une couche de
Canadians to
protection
remain up to
personnelle,
date on their
peut-être
vaccination
porter le masque dans certains
and
contextes,
even
comme
perhaps
dans
wear the
un espace
mask in
clos, un lieu
certain
bondé, avec
contexts,
contact étroit
such
avec
as when you're
les autres
in a
personnes qui ne
crowd
font pas
or
partie
in an indoor space
de
with
votre
other
ménage.
individuals you do not live with.
Merci beaucoup au docteur.
Thank you
Alors,
very much,
avec votre
doctors.
permission, il reste encore quelques minutes à la
We still
conférence
have
de
a few
presse. Est-ce que
minutes
vous avez
left
du
to the
temps
press
pour peut-être
conference.
des questions
Would it be all right
supplémentaires
with
si
you if
les
we took a
journalistes en
few
ont?
more questions
Je vois des mains
from
qui
the
sont levées.
journalists? I see a few hands
Parfait. Ben, on
raised.
va écouter peut-être une question chaque si vous en avez
So
une.
we'll
So
give
just to
one
repeat in
question
English, we
each.
do have a few minutes left to the press conference. We might have time for maybe one question if you have additional questions. So just raise your hand and let me know. But we also have a hard stop at noon. So on va commencer avec Émilie Bergeron.
Oui, bonjour. En ce
Émilie
moment, c'est la
Bergeron.
révision
Good
de
day.
la politique de vaccination
Today,
obligatoire pour les
the
fonctionnaires.
mandatory vaccine
Je me
policy for
demande
federal
quel est le
public servants is
rôle
being
que joue
revised.
l'Agence de la santé
I'm
publique du
wondering
Canada
what
dans
role
cette
the Public
révision-là.
Health
Pouvez-vous me
Agency
donner
of
quelques
Canada is
détails sur la
playing in that
façon dont vous
revision.
êtes consulté?
Can you tell me how you are being consulted?
Merci pour la question. Peut-être c'est Dr.
Thank
New,
you
je peux
for the
commencer.
question. This is Dr.
Oui,
New.
comme on
I
a
can
dit,
begin.
c'est toujours une question de donner des données probantes,
It's always
la
a
science
question
qui
of
continue à évoluer
evidence,
concernant
data, and the science
comme
which
dit,
continues
l'efficacité
to
des
evolve,
vaccins. Comme Dr. Tam et moi,
as
je
well
pense
as
qu'on
the effectiveness of
a dit
vaccines.
plusieurs fois que
As Dr. Tam and I have
l'efficacité des
said several
vaccins
times,
avant contre comme l'infection, aussi les conséquences graves, avant Omicron, était
before
pas mal
Omicron,
bon
the
et c'est
effectiveness of
peut-être une raison
vaccines against
pourquoi
severe
les
illness and
décideurs
infection
ont mis
was
en
quite
vigueur
strong.
une politique, un
And
mandat
that is
vaccinal pour les
perhaps one
fonctionnaires.
reason
Mais
why this
on voit
policy,
maintenant
this
actuellement avec
vaccine mandate
le
for federal
variant
public servants
Omicron
was put in
que
place.
l'efficacité
However,
des
since
vaccins contre
Omicron,
l'infection, la
we've
transmissibilité,
seen
ce n'est pas
that
si efficace.
the
Donc, c'est une
effectiveness of vaccines
considération.
against severe illness and
Le
infection
type
is
comme
not
des
so strong.
données probantes que Dr. Tam, moi et les autres, on continue à
Dr.
fournir
Tam,
aux
myself, and
décideurs
other experts
pour
continue to look at the data and
pour
provide them to
peut-être
decision
leur
makers
analyse pour la
so that they
politique.
may
Mais
analyze
c'est sûr
them
que
and decide on
un
a
point
policy.
important, on a dit que les vaccins
But one
maintenant,
important
même
point,
avec une série
as we
primaire,
said,
peut-être
is
c'est peut-être modifié avec une dose de rappel, mais
vaccination,
les
including
vaccins
a
en général ne
primary
sont pas si
series
efficaces contre
and booster
l'infection, la
shots,
transmission,
is still
contre
effective
le
against
variant Omicron,
the spread
comparé
of
aux autres
Omicron,
variants avant.
but less so compared
Dylan
to
Robertson?
prior waves. Dylan Robertson.
Hi, Dr. Tam. The FACT dashboard does not seem to list fourth doses yet. You mentioned last time that fourth doses are starting to outpace the growth in third doses. So I'm wondering what your understanding is of how many fourth doses have been administered and why the information isn't posted on FACT's website yet.
I can't answer the last question as to why it's not posted. I think we have most of the information as far as I know. I will have to, I don't have the numbers in front of me, but I have seen them. In some jurisdictions, it takes a bit of time to separate those numbers as to whether they're first, second, third, or fourth dose. I know that sometimes there is a lag, but that information should be available. But I haven't personally checked the website in terms of the gap that you identified. So we'll follow up on that. But yes, fourth doses seem to be some of the responsible for a majority of the increase in vaccine administered in recent weeks.
And Glenn McGregor, CTV News.
Yeah, just following up my previous question about the vaccine mandate for domestic air travel. You said 2 doses are showing, greatly diminished effectiveness. Are you suggesting that a booster dose, a third or fourth dose, should be considered as a requirement for air travel by the government?
I believe the relevant departments are looking at a range of options, and I don't think they've made any decisions on that front. So we've provided that information, but there are many other factors to consider when one is making a policy in terms of feasibility of rollout and many other factors. And I think they should also examine ethical factors, and there's always a balance between the scientific foundation, of course, but there's many other considerations as departments try to figure this out as a matter of policy. But I think from my perspective, I just want to make sure that whichever way this goes, people don't forget that vaccines are important. As provinces lifted their mandates, one of the concerns is that people will suddenly think, oh, well, in that case, we don't have to think about vaccinations. And that has to be really well managed in terms of communications.
And our last question is going to Mr. Tasker.
Yeah, thanks, doctors. As you might have seen, the U.S. FDA put strict limits on the use of the Johnson & Johnson vaccine today because of the risk of thrombosis with thrombocytopenia. I know you folks aren't the regulator, but what's your opinion on this and the other viral vector shot, AstraZeneca, given what the U.S. regulators have said about them?
Yes, I think from a Canadian perspective, there won't need to be any changes, and Health Canada is satisfied right now with the labeling of the vaccine. They don't anticipate any changes following the FDA announcements. This, I think any safety signal must be taken seriously. We've known about thrombosis with thrombocytopenia syndrome for some time. The National Advisory Committee on Immunization in Canada, well over a year ago, had recommended the mRNA vaccine over preferentially compared to Janssen and AstraZeneca vaccine. And one of the key considerations is the rare occurrence of some of these adverse events. So in the Canadian context, in the US, they used, I believe, 8 million doses administered in the United States. In Canada, we had administered 40,000 doses, so a very small number compared to the, I think, now 83 million doses that we've administered in Canada. There's been no cases of this particular clotting syndrome reported in Canada following this small number of doses because it's a rare occurrence, I think. So we don't expect a lot of changes in our recommendations.
And this is all the time we have. Ceci met fin à la conférence de presse. Alors, merci encore aux docteurs pour leur disponibilité. Et puis, on souhaite une bonne fin de semaine. Thank you very much.
And have a great weekend.
Thank you.
Thank you. Bonne fin de semaine. Bonne fête des mères.
Recording stopped.